My name is Dr. Mark Kimes, and I am a practicing doctor of chiropractic for 27 years in Salinas, California. I also do continuing education, am approved by the state of California to do that. I also do practice growth seminars, which I've just completed my 20th year anniversary of that. I'm here today because I want to talk about Dr. Jennifer Pedley, and I want to talk about the amazing radiological services that she has available to all doctors of chiropractic. The reason why I absolutely love Dr. Pedley's services and why I value them so much is because of what it does to help my practice and to help my patients have better value and understanding of what we do. It's important to know that Dr. Pedley is a D.A.C.B.R, which means that she is a chiropractor first. She's a doctor of chiropractic with a radiologist degree as well. Why that's unique and why I would recommend you use her over any other radiologist, including any medical radiologist, is because of her thoroughness and her knowledge of chiropractic and of radiology as it relates to the human body. How does this play into the value of your practice? If you have all of your films read, your x-ray films read, by a radiologist like I do, and if you've used Dr. Pedley's services, then you know this. You know that you get a report back that has chiropractic language in it. It is somebody who's looking at the detailed lines of mensuration, that's telling you how those lines are off, why the alignment isn't positioned correctly. So you have that language that you need there to support your patient's care.
And so with this, we have an AP, we have a lateral, obviously we have the straightening of the lumbar lordosis, we have some little bit of maybe some osteophytic changes, some spondylosis deformans at the L3, L4 region because the disc spacing is pretty much normal. Facet joints look good, SI joints look good. I can see paraspinal musculature off to the sides of the vertebral bodies. The lower ribs look normal, but what's in the soft tissue? Yeah, so we have a radiopacity of the right upper abdominal quadrant. On the lateral view, can you find it?
Yeah.
Is it overlying the spine or anterior to the spine? It's anterior to the spine. Very good. So if it was overlying the spine, what would that tell you?
Tumor. Or maybe something in the spine.
Maybe. Maybe it could be in the bone. Maybe. Or it could be in the kidney. Kidneys on the would overlie the spine on the lateral view. So that's how I know this is a gallstone, and it's not in a kidney, it's not in an adrenal gland, it's anterior to the spine, so it's most likely it's an appropriate location to be a gallstone.
The other thing that she does, because she's a doctor of chiropractic, is she utilizes, when it's appropriate, the terms subluxation. A vertebral subluxation is noted at the level of blank. You want that language in there because this validates and again gives value to the things that you're telling your patient. It gives third-party validation from another licensed professional that's outside your office. So when we do a report of findings, because we're on digital x-rays, and by the way, you don't need to be on digital x-rays to use Dr. Pedley's services. It just makes it easier because you send a batch of films over by email and she sends you a report back very quickly. Her turnaround time is amazing. So you can actually have that report back in time for the report of findings, which means that sometimes the patients are skeptical. Maybe they've never been to a chiropractor, or maybe they're thinking in their mind, gosh, that sounds like something I've never heard before. Maybe I should get a second opinion. They already have a second opinion because you have her written report from a radiologist that's outside your office. So it's very, very powerful. And the other thing I want to talk to you about is the thoroughness of Dr. Pedley by comparison to medical radiologists or any other chiropractic radiologist.
Your M plate being low signal and low signal on T1. And this is showing you a subacute chronic fracture. It's healing when it shows like this.
How old is it? Do you know?
Maybe like a couple, maybe a month or two, 6 weeks-ish, something like that. 4 to 6 weeks, that's what would be my guess. All right, so if it was acute, it would be bright on T2 and maybe dark on T1. And then it goes through this stage of being bright and bright on both sequences, and then it goes into dark and dark as it's healing, right? It's going to cause callus formation. So this is not because of multiple myeloma or metastatic disease. We're not seeing multiple bony lesions. We're not seeing this extend in the posterior aspect of the spine, which is also another sign of aggressive pathology if it's extending posteriorly. Also, I'm not seeing a soft tissue mass nearby, but we do have some disc bulge at L5S1 and disc narrowing, right? But then they also measured the abdominal aorta, and that's when they also confirmed that there was aneurysms of the abdominal aorta as well.
The detail of her reports are very, very impressive. If there's a pathology, if there's something that's outside of normal, she's going to state it. And she's going to pick up on things, I can tell you, that you think you would see and that you think you might pick up, but you won't, okay? I'll give you an example. You can have a license stealer. A license stealer is when there's something on an x-ray that you don't find that could mean medical malpractice if you don't find it, a rare bone cancer. I've had this happen. And only a radiologist like Dr. Pedley, who can pick up on these things, can report those, put them in the report, and protect you and your license. So it is critical, it's vital to have these services to support your patient's care and to get them the right care that they need, whether that's in your office or outside your office. She'll report on things like enlarged livers, organs that don't appear right, things that you never see in a medical report and often don't see in another D.A.C.B.R report. So again, she's extraordinary at what she does. In my opinion, she's the very best at what she does, hands down, compared to any other type of medical radiologist that you should use, and you all should be using her for all of your film reading. And you'll sleep better at night because you know you won't miss anything, and your patients will have incredible value that validates them having care without having to go get a second opinion. Thank you, Dr. Pedley, for all you do for chiropractic and our patients.
I really appreciate you guys listening today. And if you guys ever need a secondary consultation or read, my website again is jprad.com. And I read x-rays. I charge $30 per region, whether it's a 2-view or 7-view, and then $50 for MRI. I read for lawyers, other, obviously chiropractors, and for PI, workers' comp. So if you have any questions at all, just about what is the next step for imaging, please contact any of us chiropractic radiologists, any of us D.A.C.B.Rs. That's why we are here, is to help you guys. All right? So, but thank you very much, and I appreciate your attendance, patience. Thank you.